In ancient times, several plants were used for medicinal purposes, such as opium obtained from poppy plants were used as painkiller. We mainly used these plant parts for curing health problems in critical situations. But now they are used by common man to relieve the tension, to fill the solitariness, etc. It turns into the regular habit.
Hello everybody. I heartily welcome all of you to our today's lesson. Today we will discuss about the drug addiction. World Health Organization ਦੇ ਮੁਤਾਬਕ ਲਗਭਗ 10% teenagers ਅਤੇ 15% youngsters tobacco products ਜਿਵੇਂ ਸਿਗਰਟ, ਗੁਟਕਾ, ਬੀੜੀ ਆਦਿ ਕੰਜ਼ਿਊਮ ਕਰਦੇ ਹਨ। ਇਹ teenagers ਅਤੇ youngsters ਪੂਰੀ ਤਰ੍ਹਾਂ ਸਮੋਕਿੰਗ, ਡਰੱਗਸ ਅਤੇ ਐਲਕੋਹਲ ਤੇ ਡਿਪੈਂਡ ਕਰਦੇ ਹਨ। ਪਰ ਇਸ ਵਿਸ਼ੇ ਤੇ ਹੋਰ ਚਰਚਾ ਕਰਨ ਤੋਂ ਪਹਿਲਾਂ ਅੱਜ ਦੇ ਟੌਪਿਕ ਦੇ ਲਰਨਿੰਗ ਆਬਜੈਕਟਿਵਸ ਜਾਣ ਲਈਏ ਜੋ ਕਿ ਇਸ ਤਰ੍ਹਾਂ ਹਨ।
On completion of this topic, students will be able to define drug addiction, discuss the ill effects of tobacco addiction, describe the ill effects of alcohol addiction, explain the reasons of drug addiction, discuss the preventive measures for drug addiction.
The name drug is derived from a French word drogu, means a dry herb. The habitual non-medical use of certain drugs forms a habit and one becomes dependent on the drug. The dependency on drugs is called drug addiction. Some drugs in high concentration and frequent use act on the brain and change the behavior and consciousness of an individual. These drugs are called mood-altering or psychoactive drugs. These include narcotics like opium, psychomotor stimulants like cocaine, caffeine, nicotine, and amphetamines, sedatives like barbiturates, alcohol like whiskey, hallucinogens like cannabinoids and phenylcyclidine, etc. Addictive drugs are those chemical substances which, when consumed, modify the biological, psychological, or social behavior of the user through inhibiting, enhancing, or disturbing functions of body and mind. These are also known as neurological drugs, as they influence the nervous system. On the basis of their mode of action on brain, addictive drugs are divided into 4 categories. These are sedative and tranquilizers, opiate narcotics or opioids, stimulants, and hallucinogens. Firstly, we will discuss about sedative and tranquilizers. These drugs give a feeling of calmness and relaxation in the body. Their high doses induce sleep. Tranquilizers are used to reduce tension and anxiety without inducing sleep. Tranquilizers slow down the high centers of brain and relieve one from worries, but do not affect the working efficiency of the person. Benzodiazepines and barbiturates are examples of sedatives. Now let us know about opiate narcotics or opioids. Opiate narcotics or opioids act as depressants and analgesic. So these are commonly called as painkillers. These bind to their specific opioid receptors present in the central nervous system and the gastrointestinal tract. It reduces pain, tension, anxiety and lower blood pressure, induces drowsiness, tighten the pupil and reduce the visual activity. The opium affects the body weight, interest in work, fertility and working efficiency of an addict. In severe cases, it may even block respiration and may cause death. Let us explore about opium.
Opium is obtained from the dried latex of unripe capsule of white poppy plant. Poppy is a plant of Papaveraceae family. Its botanical name is Papaver somniferum. Flowering buds of the plant are used as drugs. Opium derivatives include morphine and codeine. Morphine is a strong and very effective sedative and analgesic. Codeine means methyl morphine. It is mainly used in cough syrups due to its antispasmodic effect.
एक ਹੋਰ ਡਰਗ ਜੋ ਮੋਸਟ ਵਾਈਡਲੀ ਯੂਜ਼ ਹੁੰਦੀ ਹੈ ਉਹ ਹੈ ਹੈਰੋਇਨ। ਇਸ ਨੂੰ ਸਾਧਾਰਨ ਤੌਰ ਤੇ ਸਮੈਕ ਵਜੋਂ ਜਾਣਿਆ ਜਾਂਦਾ ਹੈ, ਪਰ ਇਸ ਦਾ ਕੈਮੀਕਲ ਨਾਂ ਡਾਈਐਸੀਟਾਈਲ ਮੋਰਫੀਨ ਹੈ। ਇਹ ਇੱਕ ਵਾਈਟ ਓਡਰਲੈਸ ਬਿਟਰ ਕ੍ਰਿਸਟਲਾਈਨ ਕੰਪਾਊਂਡ ਹੁੰਦਾ ਹੈ। ਇਹ ਮੋਰਫਿਨ ਦੇ ਐਸੀਟਾਈਲੇਸ਼ਨ ਰਾਹੀਂ ਆਬਟੇਨ ਕੀਤਾ ਜਾਂਦਾ ਹੈ, ਜੋ ਕਿ ਪੌਪੀ ਪਲਾਂਟ ਪੇਪੇਵਰ ਸੋਮਨੀਫੇਰਮ ਦੇ ਲੈਟਿਕਸ ਤੋਂ ਐਕਸਟ੍ਰੈਕਟ ਕੀਤਾ ਜਾਂਦਾ ਹੈ। ਇਸ ਨੂੰ ਜਨਰਲੀ ਇਨਹੇਲ ਕੀਤਾ ਜਾਂਦਾ ਹੈ ਜਾਂ ਇੰਜੈਕਸ਼ਨ ਨਾਲ ਲਿੱਤਾ ਜਾਂਦਾ ਹੈ। ਹੈਰੋਇਨ ਸਰੀਰ ਦੇ ਫੰਕਸ਼ਨਸ ਨੂੰ ਸਲੋ ਡਾਊਨ ਕਰ ਦਿੰਦੀ ਹੈ। Another major category of drug is stimulants. Stimulants increase the activity of central nervous system. It acts as mood elevators. It can induce excitement, increase alertness and make a person more wakeful. But it is hazardous as it may cause loss of appetite, etc. It can be derived from caffeine, cocaine, betel nuts, etc. Now let us explore about alkaloid stimulants.
Coca alkaloid or cocaine is obtained from the leaves and young branches of coca plant. Cocaine, commonly called coke or crack, it is usually snorted. Do you know what snorting is? Actually, it is an activity in which addicts inhale the smack or cocaine very noisily and forcefully through the nostrils. So, it has a strong stimulating action on central nervous system. It generates a sense of excitement and increase body efficiency. It is a strong stimulant. Its overdose may cause headache and in severe cases may cause death due to cardiac or respiratory failure. Caffeine is also an alkaloid. It is derived from the seeds of coffee plants. It is the mildest stimulant and is used as cardiac and nervous stimulant. Its excessive use causes addiction.
Apart from cocaine and caffeine, there are some synthetic drugs also in use. They are known as amphetamines. Let us explore more about them. Amphetamines are synthetic drugs. They act as strong stimulants for the central nervous system. These are used by truck drivers and night workers, but it impairs the vision and for person under the influence of amphetamines loses judgment of distance. Intake of large doses of amphetamines for a few days may cause amphetamine psychosis forever. Now let us explore about hallucinogens. These are those drugs which change the thoughts, feelings and perceptions of an individual. These drugs are also called psychedelic drugs because these have a strong effect on the cerebrum and sense organs. These drugs are derived from cannabinoids. Do you know what cannabinoids are?
Cannabinoids are a group of chemicals which interact with cannabinoid receptors present principally in the brain. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa, commonly known as bhang. The flower, tops, leaves and the resin of cannabis plants are used in various combinations to produce marijuana, hashish, charas and ganja. These drugs are generally taken by inhalation and oral ingestion. These drugs severely affect the addict's cardiovascular system.
Now it is the turn of tobacco. Tobacco is used for smoking, chewing and sniffing. Tobacco ਨੂੰ ਨਿਕੋਟੀਆਨਾ ਟੋਬੈਕਮ ਦੇ ਪੱਤਿਆਂ ਤੋਂ ਐਕਸਟ੍ਰੈਕਟ ਕੀਤਾ ਜਾਂਦਾ ਹੈ। ਟੋਬੈਕੋ ਵਿੱਚ ਇੱਕ ਬਹੁਤ ਹੀ ਹਾਨੀਕਾਰਕ ਟੌਕਸਿਨ ਨਿਕੋਟੀਨ ਹੁੰਦਾ ਹੈ। ਇਹ ਟੌਕਸਿਨ ਹਾਈ ਬਲੱਡ ਪ੍ਰੈਸ਼ਰ ਅਤੇ ਹਾਰਟ ਡਿਜ਼ੀਜ਼ਸ ਦੇ ਰਿਸਕ ਨੂੰ ਵਧਾ ਦਿੰਦਾ ਹੈ। ਟੋਬੈਕੋ ਸਮੋਕਿੰਗ ਦੇ ਕਾਰਨ ਬ੍ਰੌਂਕਾਈਟਿਸ, ਸਟਮਕ ਡਿਸਆਰਡਰਸ, ਪਲਮਨਰੀ ਟਿਊਬਰਕਲੋਸਿਸ, ਕੈਂਸਰ ਵਰਗੀਆਂ ਬਿਮਾਰੀਆਂ ਹੁੰਦੀਆਂ ਹਨ ਅਤੇ ਇਮਿਊਨ ਸਿਸਟਮ ਵੀ ਡੈਮੇਜ ਹੋ ਸਕਦਾ ਹੈ। ਇਸੇ ਕਾਰਨ ਸਮੋਕਿੰਗ ਸਿਹਤ ਲਈ ਬਹੁਤ ਨੁਕਸਾਨਦੇਹ ਹੁੰਦੀ ਹੈ। ਆਓ ਸਾਡੇ ਜੀਵਨ ਤੇ ਇਸ ਦੇ ਪ੍ਰਭਾਵਾਂ ਬਾਰੇ ਵਿਚਾਰ ਕਰੀਏ।
As we know, nicotine is present in tobacco and nicotine stimulates adrenal gland to release adrenaline and noradrenaline into blood circulation. It increases blood pressure and heart rate. Smoking directly affects our lungs and it may cause lung cancer, throat bronchitis, heart disease and gastric ulcer, etc. Do you know, on an average, every smoker during smoking intake about 1 cup of tar every year? This 1 cup of tar is sufficient to block the lungs or destroy the lungs of the smoker. Due to smoking, it not only affects his own lungs, but also affects the lungs of people around him. So we must keep away from the smokers. Tobacco chewing increases risk of mouth cancer. Smoking increases carbon monoxide content in blood and reduces the concentration of hemoglobin and oxygen. This causes oxygen deficiency in the body. In severe cases, smoker may die due to cardiac or respiratory failure.
Tobacco smoking is associated with several diseases like mouth cancer, lung infections, cardiovascular diseases, gastric ulcers, pulmonary tuberculosis. It also affects fetus growth in case of smoking mothers. To sum up, we can say smoking shortens the lifespan. ਇਸ ਲਈ ਸਾਨੂੰ ਪਬਲਿਕ ਪਲੇਸਿਸ ਜਿਵੇਂ ਹਸਪੀਟਲਸ, ਐਜੂਕੇਸ਼ਨਲ ਇੰਸਟੀਟਿਊਟਸ, 에ਅਰਪੋਰਟਸ, ਰੇਲਵੇ ਸਟੇਸ਼ਨਸ, ਬੱਸ ਸਟੈਂਡਸ, ਇੱਥੋਂ ਤੱਕ ਕਿ ਰੇਲ ਗੱਡੀਆਂ ਅਤੇ ਬੱਸਾਂ ਵਿੱਚ ਵੀ ਇਸ ਦੇ ਇਸਤੇਮਾਲ ਤੇ ਬੈਨ ਲਾਉਣ ਲਈ ਕੁਝ ਕੜੇ ਕਦਮ ਚੁੱਕਣ ਦੀ ਲੋੜ ਹੈ। ਟੋਬੈਕੋ ਚੂਇੰਗ ਪ੍ਰੋਡਕਟਸ ਦੇ ਰੈਪਰਸ ਜਾਂ ਪੈਕੇਟਸ ਤੇ ਇਹ ਵਾਰਨਿੰਗ ਲਿਖਣਾ ਮੈਂਡੇਟਰੀ ਹੋਣਾ ਚਾਹੀਦਾ ਹੈ। Chewing of tobacco is injurious to health. Direct advertisement of tobacco or related products should be prohibited on Doordarshan, all television channels and radio channels as well as in print media. Do you know 31st May is observed as No Tobacco Day all over the world. And since 1st June 2007, it is mandatory to carry pictorial health warning like skull and crossbones sign on all cigarettes, bidi and gutka pouches because many tobacco users are illiterate and cannot read the health warning. After smoking, let us explore about another addiction, that is addiction of alcohol. Addiction to alcohol is called alcoholism. It is consumed in the form of beer, brandy, whiskey, rum, gin and vodka or liquor, etc. The person who has become a habitual drinker is called an alcoholic. Alcohol is a depressant that dulls the senses and acts as sedative, analgesic and reduces the efficiency of tissues. Alcohol ਨਾਲ stomach, liver, heart ਅਤੇ kidneys spoil ਹੁੰਦੇ ਹਨ। Alcoholism ਕਈ ਸਮਾਜਿਕ ਬੁਰਾਈਆਂ, corruption ਅਤੇ road accidents ਅਤੇ ਹੋਰ social problems ਲਈ ਜ਼ਿੰਮੇਵਾਰ ਹੈ। ਆਓ ਹੁਣ alcohol ਦੇ ਹੋਰ adverse effects ਬਾਰੇ ਜਾਣਦੇ ਹਾਂ।
Alcohol is responsible for violent and rude behavior. Excessive doses of alcohol, along with drugs, may lead to coma and death due to respiratory failure or heart failure. It may even cause death also. Alcoholism is especially common in youth and adolescents. Alcohol is responsible for poor academic performance, lack of interest in personal hygiene, isolation, depression, fatigue, aggressive and rebellious behavior. It also deteriorates the relationships with family and friends, loss of interest in hobbies. It is responsible for sleeping and eating disorders, resulting body weight fluctuations.
Or we can say that excessive use of alcohol during adolescence may also have long-term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages nervous system and liver and causes cirrhosis. It also affects nervous system. Alcohol may cause loss of judgment, such as improper judgment of distance, loss of willpower, loss of self-control, loss of emotions, loss of moral sense, and blurred vision. In stomach, it may cause peptic ulcers. Prolonged use of alcohol in higher doses may lead to hepatitis, cirrhosis of liver, etc. It also creates domestic problems, cause anxiety, frustration, and insecurity in children. Alcohol is associated with social crimes, corruption, violence, and accidents. An alcoholic person requires more attention from family members and friends to cope up with alcoholism. This is possible under proper medical supervision.
Sometimes people take drugs intravenously, means direct injection into the vein using a needle and syringe. These drug use